What do CNAs do? Certified nursing assistants work under the supervision of nurses and other licensed medical professionals as vital members of the healthcare team. Certified nursing assistants provide basic direct patient care to assist with daily living activities. They fulfill critical roles in various medical communities, including hospitals, residential care facilities, nursing homes, rehabilitation centers, and home health services. A certified nursing assistant job description tends to include a vast array of different tasks that may change on a day-to-day basis, depending on the specific needs of the patients under their care. Measure patients' vital signs, including temperature, blood pressure, pulse rate, and respiration. Assist patients with daily living activities, such as bathing, dressing, eating, brushing teeth, and using the restroom. Collect urine or stool samples required for certain tests by physicians and laboratory technicians. Reposition and transfer patients from their beds to wheelchairs, walkers, or other mobile medical equipment for transportation. Execute housekeeping tasks, including making patients' beds, changing bedpans, replacing linens, and collecting laundry. Record patients' health concerns and maintain reports of provided information for nurses to review. Educate patients on range of motion exercises and stretches to relieve pain or improve functioning with certain chronic conditions. Perform safety techniques, including CPR and first aid, in emergency situations. Certified nursing assistants not only provide necessary patient assessment, they are often a source of great emotional and physical support for the patients. CNAs work with patients daily to engage with them in friendly conversation and provide much-needed interaction. Nursing assistants ensure that the patient is receiving the care that they need, being an advocate on their side for health. They consistently monitor patients' response to care, record observations, and lend an ear to listen to the individual's concerns. Certified nursing assistants also make sure that the patient's room is clean, disinfected, and sanitary at all times for optimal patient comfort. When nursing assistants are employed in residential care facilities and nursing homes, they often provide round-the-clock assistance for the patient's personal care. If patients are unable to meet their own daily personal needs, CNAs offer tremendous support for effectively completing these everyday activities. Bedridden patients also depend on the nurse aides to turn or reposition them according to an established schedule for healing and comfort purposes. Overall, certified nursing assistants are warm, caring, and trained individuals that are driven to help improve patients' lives in multiple ways.
Alright, we're going to demonstrate how to wash your hands. First thing you want to do is get your paper towels prepared. So we're going to wand it and have that ready. I'm going to turn on the water to a comfortable temperature and a safe speed. We don't want to fill the sink too high. And get our hands really, really wet. We want to be able to create a good lather. I'm going to get my soap. Now I'm going to start washing my hands with pointing my hands downward. We want to go from the cleanest to the dirtiest. Our wrist is the cleanest part of our hands, and our fingertips are the dirtiest. So we are going to get a good lather. We're going to clean the back of our hands. I'm going to clean my fingernails. If you have rings, please be able to get underneath those rings because they harbor bacteria. And we're going to do this for 15 to 20 seconds. You can sing happy birthday twice, your ABCs, or just count. Okay, once I have done that, I am now going to rinse my hands. Again, pointing downward, making sure I do not touch the sink or the faucet. If at any time I do accidentally touch the sink or faucet, please let the examiner know that you are going to start over again. If you're caring for somebody, you would want to start over again because you would have contaminated yourself. Then you go through the whole process again. All right, we're not going to flick. We're just going to let our hands drip a minute and then take our paper towel and dry our hands. Since I got a very small paper towel, we're going to do get a little bit longer one. You want your hands completely dry for this process. Wetness will whip through bacteria. So we want to make sure our hands are dry before we turn off our faucet. Now with a completely separate paper towel, I am going to turn off my faucet. And with the same paper towel, I'm going to turn off my light and throw the paper towel away.
As you enter the room, address client by name and introduce yourself to client. Turn on water at sink. Wet hands and wrists thoroughly with water. Apply soap to wet hands. Lather all surfaces of wrist, hands, and fingers, producing friction for at least 15 seconds. Clean fingernails by rubbing fingertips against palms of the opposite hand. After lathering for at least 15 seconds, rinse all surfaces of wrists, hands, and fingers, keeping hands lower than the elbows and the fingertips down. Use clean, dry paper towels to dry all surfaces of hands, wrist, and fingers, then dispose of paper towels into waste container. Do not touch inside of sink at any time. Do not flick your hands to dry your hands. Let's review. 1. Address client by name and introduce yourself. 2. Turn on water in sink. 3. Wet hands and wrists thoroughly. 4. Apply soap to hands. 5. Lather all surfaces of wrists, hands, and fingers, producing friction for at least 15 seconds. 6. Clean fingernails by rubbing fingertips against palms of the opposite hands. 7. After lathering for at least 15 seconds, rinse all surfaces of wrists and fingers, keeping hands lower than the elbows and fingertips down. 8. Use clean, dry paper towels to dry all surfaces of hands, wrists, and fingers, then dispose of paper towels into waste container. 9. Use clean, dry paper towels to dry off faucet and then dispose of paper towels into waste container. 10. Do not touch inside of sink at any time.
The skill I'm about to demonstrate is taking the resident's radial pulse. When you come to the site for testing, you will have the evaluator on one side and you will position yourself on the other side. The evaluator will place her hand under the cover and she will indeed be taking the radial pulse. You will not see this, as she does not want you to see the placement of the fingers to find the radial pulse. Now, I will play the part of the candidate, and I will go through the procedure as if I were testing. Yeah. Good afternoon, Miss Rice. How are you?
I'm fine, thanks.
Okay, do you remember me on Kim? I was in earlier?
Yes, I remember.
Okay. What I need to do is go ahead and take your radial pulse, if that is all right.
Okay.
Okay. I will find her radial pulse, which is on the inside of the thumb. I found the pulse. Once I have, I will tell the evaluator, I am ready to begin. I will count the pulse for 1 full minute. Stop. I will now give Miss Rice her call button. If you need me, please feel free to call me.
Okay.
Okay. I will proceed to wash my hands before I record. This is essential. In this particular skill, you must wash your hands before you record. I will write my name. This is radial pulse, and my result will go under candidate's results. And that concludes the radial pulse.
Counts and records respirations by observing the rise and fall of the client's diaphragm for 1 full minute. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. What I'm going to be doing is counting your respirations. Give me a moment. I'm going to wash my hands. May I see your ID band? Marilyn Jones. Very good. Okay. All right. I'm going to be counting your respirations for 1 full minute. I'm going to look at my watch here, and I want to go to a whole number, which is a 3. And on the 3, I'm going to start counting. Okay. Okay. Thank you very much, Mrs. Jones. Here's your call light. Let me know if you need anything. And wash my hands. Now I'm going to document my results. Mark the box respirations. And 12. I am now finished with this skill.
The skill I'm about to demonstrate is cleaning the dentures. You'll notice we have the denture cup. I have an emesis basin, toothpaste, a toothbrush, as well as gloves. I'm going to take all my materials over to the sink. Now, you will note that it says I must have gloves on before touching the dentures. This is the denture cup. At this point in time, I do not need to be wearing my gloves. It specifically states when touching dentures. Follow me, please, to the sink area. I am going to place, once again, a barrier. Putting my equipment out. We need to partially fill our sink or line our sink, either with water or with some type of cushioning device. as our dentures are very expensive to replace. My suggestion is we are going to do both. I begin by placing the stopper in the sink. I'm turning on the water and placing paper toweling in the bottom of the sink, thus cushioning and preventing any unfortunate, very expensive accidents from happening. If you note, it says to have tepid water. I'm testing my water, and that feels good. Place my gloves on my hands. You want to protect the bristles of the brush. Never place them on a potentially dirty surface, nor do you want to place it bristle down. Always bristle up, please. Holding the dentures over the sink area, I am going to rinse the dentures, and then I'm going to place them in the emesis basin. I've dumped the contents of the denture cup. Now I make sure that I rinse out both the cup portion as well as the lid. Both portions must be rinsed. I am now filling it approximately halfway with water. Next, I wet my toothbrush. I'm going to place the toothpaste on the brush. Please put the cap up. Try not to touch the lip of your toothpaste container on the bristles themselves. Replace the cap. Now I can take my teeth, my dentures, and I am brushing all surfaces of the denture, holding it low over the sink. As you note, I'm washing all sides. Hold on because they get very slick. Flip them over. Okay. And now I want to rinse. I can now place my clean dentures back in the cup and place the lid on it. Rinse your toothbrush. Place it on your barrier. Now rinse and dry your emesis basin. Place your toothpaste, your toothbrush, make sure it's dry. Your denture cup is dry. Note that I am not placing these in our designated dirty area, as these are clean, so they will stay in a clean area. Next, I'm emptying my sink out, removing the paper towel that is disposed of, removing the stopper that's placed out. I now remove my gloves appropriately, place them in the trash, and verbalize washing my hands. And that concludes cleaning the dentures.
I am now going to provide mouth care. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. I'm going to help you brush your teeth this morning. Give me just a minute and I'm going to wash my hands. I wash my hands. Great. Let me just check your ID band. You are Mrs. Jones. And now I'm going to pull the curtain to give you some privacy. Now I'm going to gather all my supplies. A towel, some gloves, a glass of water, a kidney basin with a toothbrush, toothpaste, and also a barrier on my side table here. All right. Mrs. Jones, I'm going to raise the head of your bed.
75 to 90 degrees.
Okay? All right. I'm going to place this towel across your chest just to cover your clothing. So we got a little clothing protector there. All right. I'm going to wet the toothbrush a little bit. Place a small amount of toothpaste. All right, Mrs. Jones, you open up for me. Okay, I'm going to start at the bottom. Going up. Okay, can you close your teeth together? There we go. Good. Now I'm going to close your teeth together again. There we go. Good. Open up again and stick your tongue out for me. I think we got everything. Maybe let me try the top one more time, make sure I get all of that out there. Good. Yeah, spit out. Here's some water for you. Okay. All right, make sure that your mouth is all clean there. Great. All right. Now I'm going to clean my basin. And to rinse her toothbrush. Place the basin in the designated dirty area. I remove my gloves. I wash my hands. Mrs. Jones, here's your call light. I'm going to put the head of the bed down a little bit. Is that comfortable there? Okay, great. Now I'm finished. This is how to transfer from bed to wheelchair. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. I'm going to help you into your wheelchair. Excuse me for just a moment. I'm going to go wash my hands. Right. I'd like to check your ID band. Yes, you are Mrs. Jones. Great. I am now going to pull the curtain for privacy. Great. And now I'm going to check to make sure that the bed is locked. Great. Good. Okay, next I would like to raise your head of the bed up a little bit. It'll be easier for you to get out of the bed. Great. Okay. And bring the wheelchair. I'm going to have it facing the foot of the bed here. I'm first going to remove the footrest that's closest to the bed, and then just move this one to the center here. I'm now going to put the brakes on. Okay, Mrs. Jones, let's get you to the edge of the bed here. Okay. Now let's put your shoes on. Can I ask you to scoot to the edge of the bed there? Great. And your feet are nicely planted on the floor there. I am next going to put a gait belt, a transfer belt, around your waist, making sure that it's over your clothing. And I want it nice and snug, not too tight, not too loose. I want to be able to get my fingers through there. All right. Now I'm going to come right in the center, right here. Now I'm going to ask you to put your hands on my shoulders. I'm going to grasp the transfer belt here. Now I'm going to count to 3. On the last one, on number 3, we're going to stand. Okay? So here we go. I'm going to rock you. 1, 2, and 3. Stand. Good. Let's go on over to the wheelchair. Now, do you feel it behind your legs? Mm-hmm. Great. Can you place your hands on the armrests? Okay, let's sit down together. Great. Now, are your hips against the back of the chair? Mm-hmm. Yes, they are. Good. I'm going to remove this because it's no longer needed. All right, now I am going to put the footrest back on. Okay. Thank you. I'm going to lock this one in place. Good. Make sure the brakes are locked. Here's your call light. Okay. And I would wash my hands at this time.
Hi, I'm Alice Holland, and I'm here to present how to transfer a patient from the bed to a wheelchair. Transferring a patient from the bed to the wheelchair is a very tricky thing to do. Without proper setup and foresight, you might end up hurting the patient, or worse, yourself. Transferring a patient from the bed to the wheelchair is a very complex maneuver. First of all, you would want to make sure that there's a sheet underneath the patient so that you can move them and shift them over very easily. Second of all, you need to also set up your environment correctly. Take away all distractions and all obstacles. You want to brake the wheelchair, and you also want to have the wheelchair at a level where the patient would not block or hit the wheelchair. First of all, you bend the patient's knees. Grab onto the sheet and shift them over closer to the bed. The closer the patient is towards you, the less you will have to work and the less back injury you will incur on yourself. Turn them over onto their side. Cue them to make sure that they use their hand to lift themselves up. Then tell them, when you drop your knees, your body will come up, all at the same time. This will make things a lot easier for you, and you will work a lot less hard in maneuvering the patient. Place the gait belt around the patient's waist. It is important to use a gait belt because then that way you won't have to drag on their shorts, pants, or shirt. Bend your knees, keep your core nice and tight, and use momentum to lift them up. Tell them that you will dance in small steps toward the wheelchair. Cue them to use their hands and their arms so that they can brace themselves in case of a fall. The best surfaces for their hands to land on are the arms of the wheelchair. Slowly lower them down. You don't want them to rock backwards or else the wheelchair will tip backwards. Make sure you always place your knees against their knees so that if their knees do buckle, you can brace them very quickly.
The S440 stand aid is an active lift. This means that to use it, a client must have some mobility. They must, for example, be able to hold themselves upright. There are 3 important criteria clients must meet to use the S440. 1. Have trunk control. 2. Understand simple commands. 3. Be predictable. The client must have a FIM score of at least 3. Using the hand control, you can raise and lower the S440's boom and open and close its base. Pressing the button with an arrow indicating up raises the boom, and pressing the one with an arrow indicating down lowers it. Pressing the button on the left opens the base, and pressing the button on the right closes it. When the S440's battery is low, it will beep audibly. The S440's battery pack can be removed and charged. Alternatively, the S440 can be plugged into a wall socket. To engage the S440's brakes, press down on the lever found on the S440's wheel casters. To release the brakes, click them up. They should only be used when the lift is not being used because it is in storage. To lower a patient manually, place a pen inside this hole, and the client will be gently lowered to the ground. To manually lower a client, lift up the red lever found at the base of the S440's hydraulic pump. The S440's anti-crush feature prevents the boom from lowering in the event it encounters resistance. The emergency stop button allows you to disconnect all power from the unit. To reactivate the unit, turn the emergency stop in a clockwise manner, and power will return to the unit. The shin pad should always be positioned just below the client's knee pad. To adjust the shin pad, loosen the lever on its side. Position the shin pads at the desired height, and then tighten them. It is also possible to position them horizontally. Simply pull the appropriate levers out and adjust accordingly. The S440's lightweight construction makes it easy to move and maneuver. When approaching the client, do so from an angle rather than head-on. This is less intimidating for the client. Before attempting to transfer the client to the S440, make sure the wheelchair's wheels are locked. Next, slide the chair's footrests to the side. After sliding the sling between the chair and the client's back, make sure the sling fits the client snugly, but is still comfortable. Adjust if necessary. Use the hand control to spread the S440's leg base. This allows you to position the S440 close to the client. Make sure the shin pad and footrest are properly positioned. Slide the sling's loops over the hooks found at the end of the S440's yoke. Once secure, use the hand control to raise the client. The S440's thoughtful design extends to its hand grips, conveniently located at chest height and designed to provide multiple ergonomic grab points. When maneuvering the lift, remember to do so using straight lines, always pushing it firmly and on a right angle. This is easier and reduces the risk of caregiver injury. Designed so the caregiver can maintain a close proximity, the S440 is maneuvered without strain. Slowly lower the client down onto the bed. After the client is safe and comfortably sitting, remove the sling and help the client into place. The S440's lightweight construction makes it easy to move and maneuver. When approaching the client, do so from an angle rather than head-on. This is less intimidating for the client. Push the S440 so it is directly in front of and close to the client. The client should be in an upright, sitting position. Wrap the sling around the client's torso, buckling it firmly in place. Slide the sling's lower straps under the client's legs. Attach the sling onto the hooks found at the end of the S440's yoke. For slings like the hygiene sling being used here, which require leg support, the S440 also has hooks at the yoke's apex. Before moving the client, make sure the sling is secure. Use the hand control to slowly raise the client. The S440's thoughtful design extends to its hand grips, conveniently located at chest height, and designed to provide multiple ergonomic grab points. When maneuvering the lift, remember to do so using straight lines, always pushing firmly on a right angle. Not only is this easier, but it reduces the risk of caregiver injury. Use the hand control to spread the S440's leg base. This allows you to position the client in the most convenient manner possible, such as directly above a chair. Remember, if lowering the client into a wheelchair, the chair must be immobile, its wheels locked. Designed so the caregiver can maintain close proximity to the client, the S440 is easily maneuvered without strain. And when the client is safe and comfortably sitting, slide the sling out from under them. Designed so the caregiver can maintain close proximity to the client, the S440 is lightweight and easily maneuvered without strain. The S440's thoughtful design extends to its hand grips, conveniently located at chest height, and designed to provide multiple ergonomic grab points. When maneuvering the lift, remember to do so using straight lines, always pushing firmly on a right angle. Not only is this easier, but it reduces the risk of caregiver injury. Use the hand control to spread the S440's leg base. This allows you to position the client in the most convenient manner possible, such as directly above a chair. Remember, if lowering the client into a wheelchair, the chair must be immobile, its wheels locked.
Assist to ambulate using a transfer belt. Good morning, Mrs. Jones. My name's Michelle. I'm going to be your nursing assistant this morning. I'm here to take you for a little walk. But before I do that, I need to wash my hands. May I check your ID band as well? Make sure I've got the right gal. Yep, Marilyn Jones. All right. One thing I want to make sure is that the bed is locked. Yes, it is locked. Very good. And next I want to put your shoes on. I'm going to use a barrier. This will keep your bed clean once I put those shoes on. Okay, I'm going to raise the head of your bed up a little bit. It might help you sit up and get out of bed a little easier. How's that? All right. There we go. Good. Make sure you scoot to the edge. I want your feet planted directly on the floor there. Very good. Next, I'm going to apply the transfer belt. This belt is for your safety and my safety so that we don't get injured. Now you notice that I am squatting down and I'm keeping my back straight for good body mechanics. I want to get this belt a little snug. Not too snug though. I want to make sure that I can put my fingers underneath here so that when I ambulate you, I've got a good grasp on that belt. Okay, next, Marilyn, we're going to stand. I would like you to put your hands on my shoulders, and on the count of 3, we're going to stand together, all right? Okay. 1, 2, and 3. Do you feel dizzy? Very good. All right, now we're ready for our little walk. All right, let's go. As you notice, I'm walking slightly to the side and behind Marilyn, as well as grasping the transfer belt with my hand underneath. All right, Marilyn, let's turn back around and we're going to go back to your room. All right, Marilyn, we're here at your bed. Have you turn around. And before you sit down, I'm going to make sure the bed is in low position. Hold on. All right, good. Now, do you feel the bed behind you, behind your knees there? Mm-hmm. Good. Go ahead and sit down for me. Before you go lay down, I need to remove this belt. All right, I'm going to just put it in my pocket. All right, there we go. Good. Here's your call light. Just let me know if you need anything, and your bed is down. All right. Put this in the dirty linen. I will wash my hands, and now I'm finished.
The skill I'm about to demonstrate is fingernail care. The supplies I will need are a basin, a towel for a barrier, a washcloth, gloves, an orange stick, and an emery board. Let me begin. Come in. Good afternoon, Miss Rice. How are you?
I'm fine, thanks.
Good. I'm coming to do a little bit of fingernail care for you. Is that okay, ma'am?
Yes, that's fine.
Okay, great. Let me go ahead and provide you with some privacy. Next, I'm going to go ahead and put not only your bed up, but the head of your bed up also. I think that will probably work for us. I'm just putting this towel down as a barrier so we can keep your own bed table in case we spill any water or anything. Okay. Let me go ahead and get some water. Miss Rice, I've tested the water, but I'd like you to feel it, please.
It's fine.
Is that fine? Okay. Can you place your hand in the water? Thank you. I'll go ahead and put my gloves on. For infection control reasons, you must wear gloves when doing either fingernail or foot care. Alrighty. If I could, please, take your hand out. I'm going to use the orange stick. I'm going to go up underneath each nail. Okay. And I'm wiping after each nail. Okay. All right. Dry, and let me feel your nails. Okay, I think that's pretty good. I need to feel all of them, ma'am. There's just a little edge right here that I'd like to get rid of, if I may. So I'm going to file in one direction only. How does that feel? Is that better?
That's better, yes.
Okay. You can rest your hand down. And for testing purposes only, we will dispose of both the emery board and the orange stick. If this were a real-life situation, we would go ahead and keep these individually for each of our clients. All right, take that. And I'll place this in my dirty hamper. Once again, as we always do, we dump out the contents. We rinse our basin. We dry our basin. Remember, this is a 3-step process. If you do not do all 3, you will not receive credit for this particular step. Place your dry basin in the designated dirty area. I will now remove my gloves correctly, dispose of them, wash my hands, and now I will make my client comfortable. Miss Rice, for safety reasons, I am going to put your bed in the lowest position. Here is your call light, ma'am. Here's your overhead table, should you need it for anything. Is there anything I can do for you, ma'am?
No, I'm fine, thank you.
Okay, great. Let me put the privacy curtain back so you can chat with Miss Smith. And I am once again going to verbalize washing my hands. And this concludes fingernail care.
Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you?
Good, thank you.
Good. I need to do foot care on your foot. Is that okay?
Yes.
Okay, I'm going to go close your curtain for privacy, wash my hands, get my supplies, and I'll be right back.
Okay.
Okay, I'm going to put this on the floor under your feet. If you can lift up for me. Thank you. I need a towel and 2 washcloths. And I'm going to get a basin, soap, and lotion. I'll be right back. Would you like to check the water temperature and make sure it's okay?
Yes, that's fine.
Okay. I'm just going to set this here for a moment. And gloves are optional for this skill, but I'm going to go ahead and get a pair. Okay, Miss Jones. I'm going to remove your sock. Let me pull your pant leg up real quick. And if I can lift your leg gently, please. Okay, I don't see any openings. No red spots. We'll go ahead and soak your foot in the basin of water. And we would soak for about 5 to 10 minutes, but for the test, we're just going to say we're going to soak for 5 to 10 minutes. Once the foot has soaked, we can wash it. Okay, I'm going to put the washcloths in the basin. Ms. Jones, I'm going to lift your leg out of the basin and put it on the towel. I'm going to take a washcloth, wring it out, spray it, and I'm
I'm going to wash all surfaces of your foot, starting at the top, sides, get between the toes. Okay, I'm going to lift it up. I'm going to wash the heel and the bottom surfaces between the toes. And I'm looking for any reddened areas, any blisters, any open sores, and I don't see any. I can go ahead and discard that washcloth. And we'll let you rinse in the basin. Okay. One more time, we'll lift your foot up. We're going to set it here, and I'm just going to dry it. Okay. Dry in between each toe with a corner of the towel. And now we'll apply some lotion. Doing okay?
Yes.
Warm the lotion up in our hands. And we don't want to put lotion between your toes. That will trap moisture there. Can lead to a fungal infection. Okay, how does that feel?
Feels nice.
Very good. Wipe off the excess lotion. Okay, can you lift up for me? Take that towel away. All right, Miss Jones, we'll go ahead and put your sock back on. There we go. You can go ahead and slip your shoe on. Okay, good?
Yes.
Let me go put my linens away and take care of my basin. I'll be right back.
Okay.
Okay, I'm just going to pick up your soap and lotion and put it in the basin. Let me open this. Is there anything else I can get for you, Miss Jones?
No, I'm good.
Okay, I'm going to take this away. You have your call light there if you should need anything.
Thank you.
Throw these items away and remove my gloves. I'm going to open your curtain. Just let me know if you need anything. I'm going to go wash my hands.
Okay.
Okay, I'm going to review the steps of my skill, make any corrections, and tell the evaluator my skill is done.
Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.
I am now going to provide passive range of motion to one shoulder. Good morning, Mrs. Jones. My name is Michelle. I am going to be your nursing assistant this morning. I am going to help assist you with some passive range of motion to your left shoulder. I'm going to go wash my hands at the moment. May I see your ID band here? Great. Yes, you are Mrs. Jones. Great. Now I'm going to close the curtain to give you some privacy. Now I'm going to raise the bed. This will help prevent any injuries to my back. And the other thing I'm going to do is actually lower the head of your bed. The exercise will be much better this way. What I'm going to do is support your joints here at the wrist and the elbow, and we're going to do this 3 times. 1. Now you let me know if you have any pain and I'll stop. 2. 3. All right, good. Okay, next. The next exercise will be extending your arm away from your body. And again, I'm going to support your joints here at the wrist and the elbow. And we're going to do it 3 as well. We're going to do abduction, which is away from your body, adduction, which is towards your body. So abduction away, adduction is towards, abduction away, adduction towards. Great. Good job. All right. Would you like the head of the bed up? All right. Here's your call light. Thank you, Mrs. Jones. I have now completed passive range of motion, and I will wash my hands at this time.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
I'm wonderful. I need to do a series of exercises on your right elbow and wrist. Is that okay?
Yes, ma'am.
Okay, I'm going to close your curtain for privacy. Let me go wash my hands, get my supplies, and I'll be right back. Okay, we're going to get started. The first joint I'm going to work on is the elbow. I'm going to bring the arm up and then back down to the bed, and it kind of looks like you're making a muscle. Your job is just to tell me if there's any pain or discomfort while we do this, okay?
Okay.
Okay, the first motion is up and then back down, just like you're making a muscle. Is that okay?
Yes, ma'am.
Here's 2. Let me know if there's any pain. And here's 3, all the way back down to the bed. Very good. Everything okay?
Yes, ma'am.
Okay, now we're going to move on to the wrist joint. The first exercise we're going to do is an up-down motion, like you're revving a motorcycle. We're going to go down and up. This is 2. 1 more. 3. Feel okay?
Yes, ma'am.
The next exercise we're going to do is a side-to-side motion. I'm going to hold the wrist here, grab the palm of your hand, and we're going to turn it in and out. In and out. 1 more. In and out. Feel okay?
Mm-hmm.
The last motion I'm going to do is an around motion of your wrist, like you're waving a magic wand. 1, 2, 1 more, 3. Feel okay?
Mm-hmm.
Is there any pain or discomfort?
No, ma'am.
Okay, here's your call light. Please feel free to call me if you need anything. Are you comfortable?
Yes, ma'am.
Okay, I'm going to open your privacy curtain and go wash my hands. Thank you very much, Mr. Jones.
Thank you, ma'am.
I'm now going to review the steps of my skill, make any corrections, and tell the evaluator my skill is done.
Hi, today we're going to be doing range of motion to the hip, knee, and ankle. As always, the skill starts with high elbow I'll be right with you. I just need to go and wash my hands.
Okay.
As with all skills, upon entering the room, before you touch the patient and do any patient care, you need to wash your hands. Now that my hands are washed, I'm ready to start work. Hi there.
Hello.
My name is Miss Andrews. I'm going to be your PCT for today. Is it okay if I check your name band?
Okay, nurse.
Okay, Miss Smith. I'm here to provide you with range of motion to your hip, knee, and ankle. Is that okay if we do that now?
Okay, nurse.
Okay, I'm just going to move this out of the way a little bit. I am going to provide you with privacy. And if it's okay, I am going to raise the bed to a comfortable working position for myself. Okay, Miss Smith, I am just going to be exposing just your leg that I'm going to be working on. And we're going to begin. If any time you have any pain or discomfort, please just let me know.
Okay.
I'm going to give support to the joints, and we're going to go up for 1 and 2 and 3. Any pain or discomfort?
Oh, nurse.
Okay. And now we're going to go abduction. Ready? 1, 2, and 3. Any pain or discomfort?
No, nurse.
Okay. Now I'm going to bend your leg and bring it up. 1 and 2 and 3. Any pain or discomfort?
No, nurse.
Very good. Now I'm going to move down to your ankle. I need you to help me point your toes toward you and away. And toward you and away. And toward you and away. Very good. No pain, no discomfort?
No pain, nurse.
Very good. Okay. We're all finished. I'm going to cover you back up.
Okay.
You did very well. I'm going to give you your call light within reach.
Thank you.
And I'm going to lower your bed for you. I'm going to open up this privacy as well. And I'm just going to ask you, would you like your TV on or off?
Okay, you could turn it on.
Would you like your window open or closed?
You could open it.
And your lights on or off?
On, please.
Okay. Okay, Miss Smith, you do have your call light again. My name is Miss Andrews. If you need anything, please give me a call.
Okay, nurse.
Okay. Now I'm going to go and wash my hands before I exit the room, and we're all done.
This is how to make an occupied bed. Good morning, Mrs. Jones. My name's Michelle. I'm going to be your nursing assistant this morning. I'm here to change your linen. Give me just a minute. I'm going to go wash my hands. May I see your ID band here? Yes, you are Mrs. Jones. I'm also going to pull the curtain to give you privacy. Now I'm going to gather my linen. And I'm going to place my linen on top of a clean surface. I'm going to lower your head. This will make it a little easier to change the sheets and for you to roll over as well. I'm also going to raise the bed to prevent any injuries to my back. Great. I am now going to place a bath blanket over you. This will help keep you warm. Thank you. Can you hold that there for me so I can roll down the other linen here? I'm going to go ahead and pull that out there. Okay, Mrs. Jones, I need you to roll and grab that side rail there for me. Great, thank you. I'm going to roll the dirty linen underneath Mrs. Jones. Making sure that I keep her covered with the bath blanket, but not letting it get caught underneath her. Now I'm going to roll the clean fitted sheet underneath her, underneath the dirty linen one. All right. Mrs. Jones, can I get you to come over? I'm going to hold the blanket so you don't roll on top of that last blanket there. There we go. How you doing, Mrs. Jones? Doing all right? Good. Now I'm going to pull the sheets tight. Make sure that there are no wrinkles. Wrinkles may cause pressure sores. Okay, Mrs. Jones, come on over. Great. Can you grab those ends there for me? Very good. Okay, I'm going to roll the bath blanket off you. Okay. I'm going to change your pillowcase here as well. Lift your head up for me. Thank you. All right. Lift your head up. I want to make sure that the open end is facing the wall. Now I need to tuck in the sheets here and make sure that it's pretty even on both sides. I need to do my minored corners. Also going to pull the sheets a little bit just to give you a little room so you can move your feet around. Okay. I'm going to put your bed down. Would you like your head of the bed up? Okay. Let me make sure I have your call light next to you. All right. Excuse me. There we go. Okay. I would wash my hands at this time.
The skill I'm about to show you is positioning the client on his side. Now the materials I will need to bring in are 3 pillows. When carrying them in, please be aware that for infection control reasons, we do not want to carry this up against our uniform.
Hello.
Hello, Mr. West. How are you?
Good.
Great. I need to go ahead and get you off your back for a while, if that's okay. I'd like to reposition you on your side just for probably about 2 hours. Is that okay with you, sir?
That's good.
Okay, great. What I'm going to do is go ahead and put your head flat. I'm bring the bed up a little bit too to make it a little easier. Okay, so let me go ahead. Your bed is locked. Pull your privacy curtain. Okay, and I'm going to put this side rail up because this is the side I will be turning you to. Okay? Okay, Mr. West. Let me go ahead and we're going to put your arm just like this. You don't have to hold the side rail, sir. Just like that. Then I'm going to roll you as one unit towards that raised side rail. Okay? I'm going to uncover you so that we can see what I am doing. And I'll cover you back up when we're done. Okay? I'm going to roll you towards your side rail. That's great. Let me go ahead and adjust this pillow under your head. How's that, sir?
Good.
Okay, great. I'm now putting one to your back. I'm going to push this pillow underneath you, like so, and then roll it. And now, sir, you can come back just a little bit. How's that?
Good.
Okay. The next pillow, I'm going to flex your top leg. And this is going to be supporting the knee and the ankle. Please make sure, students, that both the knee and the ankle are supported by your pillow. Now, Mr. West, I'm going to put this pillow right here. Okay, and we've got you off your shoulder. Good. How's that?
Good. Very
Is your head comfortable, sir?
Yes, it is.
Okay. Here is your claw light. And put that in your hand. We can go ahead and cover you back up. Oh, that leg doesn't want to stay flexed. There you go. I'm going to put your bed down to the lowest possible position. And because you're so close to that side rail, for safety, we're going to go ahead and leave that up. Mr. West, is there anything else that I can get for you, sir?
No?
No?
I'm all set.
Okay, great. Well, let me open your privacy curtain. I'm going to go ahead and wash my hands. And that concludes repositioning the patient on their side.
Assist with the bedpan. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. I understand you need to use the bedpan. Very good. Give me a moment. I'm going to wash my hands. May I see your ID band? Yes, you're Marilyn Jones. Very good. I'm going to pull the curtain for privacy. Right. Next, I need to make sure that the head of the bed is lowered. And it is. Very good. I'm going to put some gloves on. It's very important to place the bedpan correctly. The wide end should go underneath the buttocks. Marilyn, can you lift your hips up for me? How's that feel? Okay. All right. Remove my gloves. Wash my hands. Marilyn, I'm going to put the head of the bed up. Let me know when it's comfortable. Next, I am going to give you here some toilet paper to wipe yourself when you're done, and then the hand wipe. When you're finished wiping, you can clean your hands. And the call light's right here, so when you are finished, just let me know. I'm going to be right behind the curtain. Marilyn, all finished? Very good. I'm going to lower the head of your bed. All right, Marilyn, if you can lift your hips up for me. Very good. All right. Throw this away. Empty out the bedpan. Place the bedpan in the dirty designated area. Wash my hands. All right, Marilyn, here's your call light. Would you like the head of the bed up a little? All right, great. And I'll just put this right back. If you need anything, just let me know. Now I'm finished. I am now going to dress my client with an affected right arm. Good morning, Mrs. Jones. My name is Michelle. I'm going to be your nursing assistant this morning. Excuse me just a moment. I'm going to wash my hands. Wash my hands. Mrs. Jones, may I check your ID band? Make sure I've got the right gal here. Yep, you are Mrs. Jones. Great. I'm here to help you put your blouse on this morning. First, I'd like to ask, which one would you like to wear? The blue one or the red one? The blue one. Okay, will do. First, I'm going to close the curtain, give you some privacy. Now I'm going to raise the bed up. This will help so I don't injure my back. I would like to raise the head of the bed up a little bit. This will make it a little better for you to get dressed here. That okay right there? Okay. If you can sit up for me just a little bit. Great. So I can untie your gown here. Good. Okay, come on back. There we go. I'm just going to roll your blankets down just a tad bit so I can get to you a little bit better. All right. Now, if you can help me here, take your arm out of this sleeve there. Great. Okay. Now, I'm just going to hold your arm here, support your joints. Get this sleeve off. Okay, great. Okay. I'm going to support your arm again. Making sure that you're comfortable here. All right. Can you sit up for me? Great. And if you could put your arm through. There we go. Great. All right. Go ahead and lay back down. And now I'm going to dispose of the dirty gown. Button all your buttons here. Is this your favorite blouse? I noticed that you choose this one almost every morning. Great. Okay. I'm going to place your arm above the blankets here. There we go. Okay. Put the rail back up. Would you like your head back down a little bit? Okay. Here's your call light. Make sure you have that there. Put your bed back down. Great. I'm done. I will wash my hands at this time. provides perineal care or pericare for a female. Good morning, Mrs. Jones. My name's Michelle. I'm going to be your nursing assistant this morning, and I'm here to give you pericare. Give me a moment. I'm going to wash my hands. I need to see your ID band. Yes, Marilyn Jones. Very good. I'm going to pull the curtain for privacy. I am now going to gather my supplies. I need a barrier for my table. Large towel to dry. Protective barrier. A bath blanket. Washcloth. Soap. And a pair of gloves, as well as a large basin of warm water. I need to check the temperature of the water using my wrist or my elbow. Mrs. Jones, I need you to check the water temperature for me. That comfortable? Very good. I am now going to raise the bed up a little bit for my body mechanics. Next, I am going to apply a bath blanket. This is to keep you warm. All right, Mrs. Jones, can you bend your knees for me? There we go. I am now going to wrap your legs. This is going to keep you warm. And place the one corner under your heel. Grab the other corner here, wrap it around your leg. Place it under your heel. Now I can keep privacy. I now need to place my clean gloves and place my protective barrier. Ms. Jones, lift your hips up a little. Very good. My washcloth. Apply some soap, just a small amount. And I am now ready to wash peri area, front to back. Now I'm going to use another area of the washcloth to go down the other side. Now the other side. Now I'm ready to rinse. Front to back, using another side of the washcloth on one side, another area of the washcloth on the other side. I am now ready to dry. Dry padding down front to back. All right, Mrs. Jones, I need to do your back side. So I'm going to ask you to roll onto your side. Put your knees down. I'll help you. You can just extend your arm and hold on to that rail for me. That would be great. Okay. Bend your leg over that way. There we go. And keep it covered. All right. Apply some soap. Again, front to back. Use another area of the washcloth, front to back. Now I'm ready to rinse that soap off. There we go, front to back. Another area of the washcloth, front to back. Ready to dry, front to back. All right, Mrs. Jones, let's get you back onto your back here. There we go. All right. Okay. Cover you back up with your sheet here. Remove your bath blanket. Okay, now I'm ready to remove my soiled supplies. I will throw this away. I will now empty out the large basin into the toilet. I need to rinse as well as empty into the toilet. Dry the basin. Place in designated dirty area as well as the soap. Remove my soiled linen. Place in a dirty hamper, making sure that it is away from my uniform. Remove my gloves. Wash my hands. Okay, Mrs. Jones, thank you very much. I am going to lower your bed to the lowest position. And here is your call light. Let me know if you need anything. I am now finished with this skill.
Providing catheter care to a female resident who has an indwelling urinary catheter. The candidate is asked to provide catheter care to a female resident who has an indwelling urinary catheter. Soap and water should be used for the catheter care. For testing purposes only, the cleansing of the front perineal area and the catheter are evaluated. Cleansing of the rectal area and buttocks is not tested in this skill. A mannequin is used for the role of the resident. For testing purposes, the side rails will not be used, which is consistent with the testing site. Supplies for this skill include a basin filled with warm water, 2 washcloths, a bed protector, 1 towel, soap, and gloves. Come on in.
Hi, Mrs. Jones. My name is Rance, and I'm going to be your CNA today. Let me just wash my hands. I'm going to go ahead and give you your catheter care, just clean you up. Is that okay?
That's great.
Okay, let me pull this curtain, get my supplies. Is it okay if I raise your bed up some?
Sure.
And let me just check your name band. Okay. I'm just going to raise your bed up just a little bit. gloves on. Okay, I'm going to get you to scoot over a little bit towards me, okay?
Okay.
There we go. And now I'm going to ask you to just go ahead and roll over on your side, okay? 1, 2, 3. Okay, can you roll back over for me? And now roll over on this side.
All right.
Okay, let's get you squared up. There we go. All right, I'm going to pull your sheets down just a little bit. Okay. Let me get my washcloth ready. Okay, I'm going to start by cleaning around the sides of your labia. Okay. 1, 2. And I'm just going to hold the catheter here and go down about 6 inches. There we go. I'm just going to rinse that off. You feeling okay?
Yep, I'm doing fine.
Okay. Thing. Just gonna pat you dry. Does that feel all right?
Mm-hmm.
Okay. And now, one more time, I'm going to get you to roll over, or come over towards me a little bit. And now, can you just roll over on your side?
Alrighty.
There we go, thank you. Just going to roll this pad up. Now, can you roll back over towards me?
Okay.
Toss that. Does that feel okay? You feel clean and comfortable?
I do.
Okay. Let me just lower your bed down. I'm going to come around to the other side for just a second. I'm going to make sure your catheter is looped. It's under your leg. Let me just make sure it's coiled like that. Okay. I'm going to clean up my supplies and then I'm going to be right back, okay?
Okay. Bed's down. Give you your call light. Okay.
There you go. And let me bring your table back closer to you. There you go. Is there anything else I can get for you, ma'am?
No, I don't think so. I think I'm good.
Okay. Well, I'll be back to check on you later, okay? Wash my hands. I'll see you in about an hour, okay?
Okay, great. Empty urinary drainage and record I&O. The candidate is asked to empty the resident's urinary drainage bag into a graduate container and to measure the amount of urine. An intake and output form is provided to record the measurement. The output should be recorded as urine and the correct time recorded for the measurement. The role of the resident is played by either a person or a mannequin. Come on in.
Hi, Mrs. Jones. My name is Rance, and I'm going to be your CNA today. Let me wash my hands.
Okay.
I'm going to just empty your catheter bag. Is that okay?
Okay, that's fine.
Okay. Check your name tag. Okay. Let me come around the side and give you some privacy here. Okay, just going to get my gloves on. How are you doing today?
I'm doing great. I wish this tube would be out, but I guess if it's got to be there, it's got to be there.
Yeah, I'm sorry. I know it's not the most comfortable thing in the world. Just going to grab my alcohol wipe and a paper towel. My graduated cylinder here. I'm going to raise your bed up just a little bit, okay?
Okay.
Well, I can't take it out, but maybe I'll make it a little bit lighter for you, okay?
Okay.
Okay, lower your bed back down. Just going to check and make sure your tube is coiled. Just coil it there. Okay. And I'm going to go ahead and empty this container, okay, and I'll be right back.
Okay.
This is 825 milliliters. Go ahead and empty that now. Okay, Miss Jones. Let me give you your call light. There you go. You feel clean and comfortable and everything?
Yes, I do.
Okay, let me just get my gloves away. Anything else I can get for you right now or do for you?
Not that I can think of.
Okay, I'm gonna wash my hands. I'll come back to check on you in an hour, okay?
Okay. Thank you.
Now I'm just gonna record.
Hi, My name's Adam. I'm a final year medical student. Can I check your name?
It's Lewis Potter.
Great. And what's your date of birth, Lewis?
It's the 5th of the 9th, 1988.
Okay. I need to insert a catheter to monitor your urine output. This will involve me inserting a small flexible tube into your penis to reach the bladder. It might be a little bit uncomfortable, but it shouldn't be too painful. I'll insert some local anaesthetic into the penis to make the procedure as comfortable as possible. Have you ever been allergic to local anaesthetic?
No.
Okay. There'll be a member of the nursing staff present throughout to act as a chaperone. Does all of that sound okay?
Yeah, that sounds fine.
Great. I'll just go and get my equipment ready. I'm going to insert some local anaesthetic now. It might sting a little bit, but it should go numb quite quickly. Now I'm going to insert the catheter. Let me know if you feel any pain. Okay, that's the end of the procedure. Thank you very much.
Thank you.
To complete the procedure, I would fill out all relevant documentation, making sure to note urine colour, residual urine volume, and any complications.
Measures and records urinary output. I am now going to put on my clean gloves. Place the barrier under the graduate. Empty the urine into the graduate. Try not to spill. I am now going to measure the urine at eye level. 250 milliliters. Empty the urine in the toilet. Rinse the graduate and empty that into the toilet. Rinse the bedpan, empty that as well into the toilet. Remove my gloves, wash my hands, and now I will record my results. I will mark the urine output box, 250 milliliters. I have now finished this skill.
Hi Grace, it's Leanne, your CNA. I'm here to do your bed bath. I'm going to go ahead and sanitize, and I'll get my supplies and I'll be right over. Make sure to cover all surfaces until they're dry. Alright, so I need to get my supplies. I'm going to get a barrier and a towel, 3 washcloths. I do not need gloves for this skill. I need a new gown. Alright. Go ahead and get my bucket for my water. Want to make sure to get comfortably warm water. And I'll need to check that with my wrist, especially if you have gloves on. Okay. All right, Grace, I'm going to go ahead and check my brakes. This one's way in the corner. So I sanitized, I got my supplies, I locked the bed. I'm going to raise the bed to a comfortable height. And I'm also going to pull the curtain. I'm going to try to raise that, but it's not going to raise for me. I'm going to grab a bath blanket and I'm going to go ahead and cover you up. Make sure to keep you warm and keep you covered. And then what I'm going to do is have you hold on to this one. I'm going to pull your covers down, okay? So I'm preparing you for a full bath. I'm only going to wash your face, your arm, your hands, and underarm. Okay? Okay. Right. First, I'm going to take your gown off. Okay? So I am going to keep you covered. All right.
you go. Right, this will go in the hamper. Now we can wash your face. I'm going to cover you up with a towel. Keep you warm too. Go ahead and make a mitt. So I'm going to clean your eyes. I'm going to use a clean corner of the washcloth with each wipe. All right, go ahead and get your face.
Okay.
Nice and clean. All right. Go ahead and pat you dry. Right. I'm going to go ahead and wash your arm. Put the towel under there. So the face is washed without soap, but the arm we're going to use soap first. Alright. Does the water feel okay? Get your hand. And get under your arm. Get you good and rinsed off. Get your underarm too. I'm going to use this towel, dry you. Alright, make sure I get under your arm too. Alright. Go ahead and get your gown back on. For state board, you only have to wash one arm. Alright, so what I'll have you do is just put your arm through there. Make sure to keep you covered. I'm just going to do a little loose tie. Going to remove the bath blanket. All right, are you comfortable?
Yes.
Okay. Get your covers fixed for you. All right, I'm going to go ahead and give you your call light and your water. Going to lower your bed. I'm going to open the curtain. All right. Take care of my supplies. I'm going to take care of my supplies. I'm going to rinse And dump the water out, then rinse everything off. I'm going to return my supplies to storage. All right, call me if you need anything, okay? I'll go ahead and sanitize, and then I'm done. And I'm done.
Assist to ambulate using a transfer belt. Good morning, Mrs. Jones. My name's Michelle. I'm going to be your nursing assistant this morning. I'm here to take you for a little walk. But before I do that, I need to wash my hands. May I check your ID band as well? Make sure I've got the right gal. Yep, Marilyn Jones. All right. One thing I want to make sure is that the bed is locked. Yes, it is locked. Very good. And next I want to put your shoes on. I'm going to use a barrier. This will keep your bed clean once I put those shoes on. Okay, I'm going to raise the head of your bed up a little bit. It might help you sit up and get out of bed a little easier. How's that? All right. There you go. Good. Make sure you scoot to the edge. I want your feet planted directly on the floor there. Very good. Next, I'm going to apply the transfer belt. This belt is for your safety and my safety so that we don't get injured. Now you notice that I am squatting down and I'm keeping my back straight for good body mechanics. All right, I want to get this belt a little snug, not too snug though. I want to make sure that I can put my fingers underneath here so that when I ambulate, I've got a good grasp on that belt. Okay, next, Marilyn. We're going to stand. I would like you to put your hands on my shoulders. And on the count of 3, we're going to stand together, all right? Okay. 1, 2, and 3. Do you feel dizzy? Very good. All right, now we're ready for our little walk. All right, let's go. As you notice, I'm walking slightly to the side and behind Marilyn, as well as grasping the transfer belt with my hand underneath. All right, Marilyn, let's turn back around and we're going to go back to your room. All right, Marilyn, we're here at your bed. Have you turn around. And before you sit down, I want to make sure the bed is in low position. Hold on. All right, good. Now, do you feel the bed behind you, behind your knees there? Mm-hmm. Good. Go ahead and sit down for me. Before you go lay down, I need to remove this belt. All right, let me just put it in my pocket. All right, there we go. Good. Here's your call light. Just let me know if you need anything, and your bed is down. All right. Put this in the dirty linen. I will wash my hands, and now I'm finished.
hand washing. Use a barrier, cut on your water faucet. You want to use warm water during the skill. Make sure that your watch is up so that it allows you to wash your wrist. Wet your hands first. Apply soap. Provide 20 seconds of friction to your hands. Make sure you get in between your fingers, around your wrist, and up and down every finger. Last, clean your nails. Clean around each cuticle and under every nail. When you rinse, be careful. Try not to touch the sink. If you touch the sink, you have contaminated your cleansed hand. Be sure to remove any soap that's remaining on your skin. Cut off your water. As you dry, be sure to only start at the part that has been washed and is wet. Pat your hands dry. When the napkin becomes saturated, get another one. And now you can perform your skill on your patient. Blood pressure. Select the appropriate size cuff based off of your patient's or resident's arm size. You'll need a blood pressure cuff, your stethoscope, and alcohol. Clean the diaphragm of your stethoscope as well as your earpieces. If using a double stethoscope, make sure you clean your earpieces and the instructor's earpieces as well. Mrs. Jenkins, may I take a blood pressure on your left arm? Yes. Support the resident's arm. Make sure that the end of the cuff is 2 finger widths above the antecubital area or the inner bend of the arm. You want the cuff at the level of the heart. From the pinky up, locate your brachial artery. This is where you would want to place your stethoscope. Safely inflate your blood pressure cuff. For your first blood pressure, do not go above 160. Slowly decrease the pressure on your cuff. The first thump you hear is called the systolic blood pressure. The last thump you hear is the diastolic blood pressure. Remove your blood pressure cuff. Document your numbers. And clean your equipment at the end of your skill. Jenkins. I'm here to do your pulse and respirations. I've already washed my hands and I've closed the door for privacy.
Okay.
And I'm going to begin now. Count the pulse for 1 full minute. Then watch the resident's chest rise and fall for another full minute. 1 exhalation and 1 inhalation equals 1 breath. Okay, Miss Jenkins, I've finished your pulse and respirations. I'm going to go document now. You have your call bill. Anything else I can do for you?
No, thank you.
All right, thank you very much. Wash your hands and document. Miss Jenkins, let's make sure your feet are flat on the floor. We're going to get you to the scale and weigh you today, okay?
Okay.
All right, on the count of 3, I'm going to help you up. 1, 2, 3. Are you dizzy?
No.
All right, let's slowly walk to the scale. Let me stop you. I'm going to 0 the scale first. Let me assist you onto the scale. Very good. I have an arm behind you for safety. Very good. Let me help you step off the scale. Okay. And can you turn around for me? We'll walk slowly to your chair. Document your findings, wash your hands, and give the resident the call bill before you leave the room. Feeding. To perform feeding, you will need a clothing protector, washcloths, water, a spoon, and the food of the resident's choice. Gather your supplies and move your bedside table. Miss Jenkins, I need to raise your head before we start feeding you.
Okay.
How are you doing today?
Okay, thank you.
Would you like applesauce or pudding?
Applesauce, please.
Okay. Would you like to wash your hands before we begin?
Yes, please.
Raise your patient to a minimum of 60 degrees. Wet half of a washcloth and leave the other half dry. Ms. Jenkins?
Thank you.
Hands, please. Thank you. Take soiled linen to the hamper and apply gloves before feeding the resident. Jenkins, I'm going to put your clothing protector on. How have you been doing today?
Good, thank you.
Put this around your neck. Is it okay if I sit you up a little more?
Oh, absolutely.
Yeah, this is for your safety. We don't want you choking. I'm going to start off with some water. Did your family come by yesterday?
They did.
Very good. Did they bring the puppy?
They did. It's getting big.
Start off with some water. Did it go down? You wipe your mouth. You like this applesauce. Yes. Make conversation with the resident. Use a spoon to feed. Good. And make eye contact. Can I see if it went down? Good. Very good. And one more bite for me. Very good. Can I give you some water to wash that down with? And I'm going to wipe your mouth again. Would you like some more to eat?
Yes, please.
Okay. Very good. When you're feeding a resident, always make sure they're swallowing before you proceed with the next bite or any water. Just want to make sure. Open up. Very good. Some water. You did so well today. You're eating much more.
I have an appetite finally.
Yay! Clean up your supplies, take off your gloves, wash your hands, and then document the food intake in percentages. I'm going to save this in case you want it for later. When you're removing your linens, remove them away from you so that you do not contaminate yourself or clothing. Place your linens in the hamper. Take off your gloves. Wash your hands. I'm going to document that you ate 25% of your applesauce. And we're almost done. Let me take off your clothing protector. You have your call bell. Would you like to be lowered any?
No, thank you.
Is there anything else I can do before I leave you?
I don't think so.
You have a great day. The next skill we will be demonstrating will be mouth care brush teeth. You will need a clothing protector, a washcloth, toothbrush toothpaste, a cup of water, and an emesis basin. You also must wear gloves for this skill. Miss Jenkins, we're going to raise the head of your bed. I have to sit you up some more, okay? I'm sorry. Let me know if it's causing you any discomfort. Is that okay? Apply your clothing protector. You can sit up for me just a little bit. Thank you. We don't want to get anything on that beautiful gown. Would you like to rinse your mouth before we start?
Please.
You can either swallow it or spit it out, either one you like. You swallowed? Wet your toothbrush first. Got your favorite flavor toothpaste, bubble gum. Apply a small amount of toothpaste. Brush all surfaces of the teeth and the gum line. And you can close for me. Get them together. And I got gloves on them. Get it around. Very good. You have beautiful teeth. I don't want to hurt you. Am I hurting you any?
Mm-mm.
Make it up top. Do you need the rinse now? Or can I go to your tongue? Stick your tongue out. And I apologize if I'm hurting you. This for me. We're going to have you rinse again, okay? And then I'll wipe your mouth. Rinse again. And wipe your mouth and your chin so I can make sure everything's dry. How do you feel now?
A lot better, thank you.
I'm going to clean up my supplies and I'll be back to remove your clothing protector. To the toilet. Flush. Rinse your equipment. Dry your equipment. Disinfect if the nurse asks you to. Store your equipment. Do not contaminate the door handle. Have a separate barrier for the door. Any supplies you've yet to store, go ahead and do so now. Close your cabinet back. At most test sites, the toothbrush is disposable. Miss Jenkins, I'm going to go ahead and lay you back some, okay?
Okay.
Is that okay? You have your call bill. Is there anything else I can do for you?
No, thank you.
Tidy up your room. Take off your gloves. Wash your hands and exit the room. Before providing denture care, line the bottom of the sink with a washcloth to protect the dentures from breakage. Use cold water only on your dentures. Remove your dentures from the denture cup. Wet your dentures. Wet your denture brush. Apply toothpaste or denture cleanser. Brush all surfaces of the denture, including the gum line. Rinse your dentures and also rinse your brush. When you're storing your dentures in water, place water up to the gum line. Remove your washcloth. Place it in the soiled hamper. Get a clean barrier to store your equipment.
Hi, my name is Vicki and I'm going to be your CNA today. How may I address you? Leanne. Hi, Leanne. I'm going to take your blood pressure. Okay. Okay, I'm going to get myself ready and I'll be right back. Okay. I'm washing my hands. Okay. I'm pulling the privacy curtain. I am locking the bed breaks, which are the opposite sides of the bed. Excuse me, examiner. Locking the bed breaks. And if I would need to, I would adjust the bed to proper working height. And the skill requires either a recumbent or a sitting position. So I'm going to sit her up. There you go. Sit her up. I'm going to bring the table over because her arm needs to be at the level of the heart. So this is going to go up just a little bit. That's about right there. Take this pillow, get a little more comfortable for her. That's about the level of the heart there. I'm going to locate her brachial artery, which is right there. I'm going to put my blood pressure cuff several inches above that. I clean the earpieces both for myself and for the examiner, both. I locate the radial artery. I close my valve and make sure that the gauge is visible to the examiner, and I'm going to start pumping. I stop feeling the pulse at 120, so I'm going up 30 more. Position my stethoscope over the artery and start slowly releasing. Stethoscope off.
Man.
Hi, I'm Vicki. I'm your CNA today. How may I address you?
Leanne is fine.
Hi, Leanne. I'm here to do your blood pressure. Okay. So I'm going to wash my hands, get my equipment, and get started.
Okay.
So I'm washing my hands. I am pulling the privacy curtain because privacy needs to be provided for this skill as well. Cindy is my test examiner. Okay. All right. I am going to start by making sure that my resident is in a sitting or recumbent position, which Leanne is. I'm going to put this pillow here in order to get her arm at the level of the heart. If I didn't have this pillow, I could use the bedside table also and adjust the height to get it at the level of the heart. I'm going to locate her brachial artery, just medial of the arm here. And it's a deep artery, so you have to really palpate. So I feel it about right here. So I would put the blood pressure cuff several inches above that. And the blood pressure cuff, there's an arrow for the left arm and the right arm. So this is her left arm, so I would position that several inches above the left arm. So there's my left arrow. It's about right there. Apply the blood pressure cuff snugly. Make sure that the examiner and I both can see the gauge. I'm going to clean the diaphragm of the stethoscope and the earpieces for both myself and for the examiner. Thank you. You're welcome. And the earpieces are correctly applied by making sure that the point of the earpieces are towards the nose. I tap the stethoscope to make sure that it is on. The green button says that it's on, or I can turn it just to verify. So it is on. Okay. Make sure my valve is closed. Okay. I feel her radial artery. And I'm going to continue to feel it and pump the blood pressure cuff, or pump it up until I don't feel it anymore, and then go 30 above. Okay, so I stop feeling it at 120. I'm going to go up to 150. Okay, and I'm going to put my stethoscope over her brachial artery and slowly release. Blood pressure up. I write down my blood pressure before I forget. All right, thank you, Leanne. I wash my hands. I open the privacy curtain. I hand Leanne her call light and her water. I hand my reading to the examiner, and I am through.
And her systolic is within 6 points of the systolic and 8 points of the diastolic, correct?
It's important to check the person who fell for injuries and call 911 if needed. Only attempt to help the person if you feel that both of you are able to safely work together. Otherwise, call for assistance. To help someone up from the floor, they will need to get into a crawling position. If the person is on their back, help them to bend their knees up, reach across their body in the direction they want to go, and roll over onto their side. Help by gently pushing at the hips and shoulder areas. Now help them to bring the top leg out in front of the bottom leg. Place your hand under the shoulder touching the floor and lift the person so they can pull out the arm and rest on their hand. Now move your hands to the hips and help lift them up and over, allowing the patient to get onto their hands and knees. Guide the person in need to crawl close to a sturdy, secure piece of furniture and place their hands on it. Help them to pull their knee forward and place their foot directly under the knee. This should be done with the leg they feel is the strongest. Come around to the other side of the person and help lift them to stand by hooking one arm under their arm and placing your other hand on their back. Remind the person to lean forward while pushing up with the bent leg and both arms. Have the person stand for a moment to make sure they are steady and not dizzy. Slowly turn and sit.
The next transfer to be demonstrated is a dependent transfer where the person cannot assist you with the transfer. I'm going to take the person first and have them close to the surface we're going to transfer. We're going to pretend this chair is, say, their bed. You're going to go and remove the armrest on the wheelchair first before you move them over. I'm going to get myself into the same position as I did before for a stand pivot transfer, but I'm going to bring my knees, their knees right into my knees and grab them with my thighs. I'm going to pull them forward away from the back and then lead them forward. They can hold on to me where comfortable. I'm going to again grab behind them and maintain good body mechanics with a low back curve before I do this transfer. What I'm going to do is on a count of 3, do all of the work myself. You're going to do a 1, 2, 3. Once I know they're there, then I can reposition them all the way back into their chair or the bed surface, wherever you're going to, and then get them safely and securely into that seated position. And that's a dependent transfer.
Alright, so after we take the heart rate, we move on to blood pressure. And so there's some equipment that you need to have prepared for this. This is the blood pressure cusp, and so this whole black Velcro thing is what you wrap around the patient's arm. And you have the pump right here, which you pump up to put air in here, and that's what gets it tight around their arm. And so before you begin, you got to make sure this is twisted all the way to the right, righty-tighty, lefty-loosey. So when you have it all the way to the right, that's how you close it off so that air actually pumps into here. Otherwise, you'll keep squeezing and nothing will be happening. The meter, so when you pump it up, you can gauge how much air you have in by how high the numbers are. And you listen for the pulses with the stethoscope. When you put it in your ears, make sure that these prongs are facing forward, not backwards. Even though that's what you think it should be, you face it forward. And double check to make sure it's on by twisting. You can twist this and tap on it. So here, right now it's not really making a noise in my ear, but when I twist it, then I can hear it. And so that's how you know if your stethoscope is on and working. Otherwise, you might be sitting there and be thinking this person has no pulse, when really your stethoscope is just turned off. And then you have the patient put their right arm up on the table, and we use the right arm just for consistency throughout all the tests. So what you're going to do is you're going to try to see if you can find a pulse on the brachial artery. It's usually towards the inside of their elbow, around here. And you kind of just take a little mental note of that. And you're going to wrap the cusp around their arm. Keep it snug, but not super tight. You just don't want it to have it loose and wobbling around. So you put these in and put the head of the stethoscope right where you had that pulse. And double check to make sure this is all the way tight. And you're going to squeeze. And by doing this, you pump air into the cusp. So I'm going to pump it up again just so you can see in the camera what's going on. So we have it up to about 200, and then we slowly let some air out. And that's where I heard my first thump, and you can see the dial bouncing up and down. And the last thump I heard was at about 64. So I got about 118 over 64, because that's where I heard my first thump, heard more, watched the dial bounce up and down, and about 64, I didn't hear anything anymore. But essentially what you're looking for is when you release the air, you'll see the dial go, and you'll begin to hear thumps, usually around 120. That's just kind of an average. Some people might be a little higher, a lot of people are lower than that. And what you're hearing here is the first thump is their systolic pressure, so that's when the heart has contracted and that's their highest pressure. And you'll continue to hear light thumps, and the last thump you hear is the second number you record, and that's their diastolic pressure, and that's when the heart is relaxed and it's refilling with blood. A lot of times people are a little scared of because it's kind of the more challenging one, but with a little bit of practice, you guys will be stars.
Hi, I'm Josh Farquharson, and this is Reading Height Measurements on a Physician Mechanical Beam Scale with Adjustable Height Rod. By the end of this lesson, you will interpret the calibration markings on the adjustable height rod of a Physician Mechanical Beam Scale, and determine the height indicated on height rods with and without the number of feet indicated on the rod. Let's begin. Here are the parts of the height rod that we will focus on today. The lower rod with the indicator line, and the upper rod with the headpiece. The lower rod, also called the outer rod, is stationary and cannot be adjusted. The upper rod, also called the inner rod, is the adjustable portion of the height rod. It can be raised and lowered as needed. The headpiece, which is currently in its resting position, extends and is placed on top of the patient's head during height measurement. The indicator line is also called the read line. Some rods also include a read arrow. You will determine the patient's height by observing the indicator line and calibration markings. Here's a general overview of how the height rod works. The patient steps on the platform. Raise the height rod so the headpiece is above the patient's head. Lower the headpiece onto the patient's head. Make sure the headpiece is flat. If it is slanted downward or upward, you will produce an inaccurate result. Remember, make sure the headpiece lays flat atop of the patient's head. Now that you have a general concept of how the height rod works, we will now focus on interpreting the calibration markings on the height rod. The lower rod is generally used for those who have a standing height of less than 3 feet 4 3/4 inches. Let's look at each of the calibration markings on the lower rod closely. We will focus only on the right side of the rod since our concentration is in feet and inches and not in centimeters. Notice that you have lines for feet, inches, and fractional inches. The fractional lines represent quarter, half, and 3/4. On the lower rod, the numbers increase from bottom to top. For example, here is the 3-foot line. This line represents 3 feet and 1/4 inch. This line represents 3 feet and 1/2 inch. And this line represents 3 feet and 3/4 of an inch. And this line represents a height of 3 foot 1 inch. Let's practice a few. State the height in feet and inches according to the marker. If you stated 3 foot 3 inches, you are correct. Here's another. If you stated 3 foot 4 1/4 inches, then you understand the calibrations on the bottom rod completely. Let's see if you can master the upper rod as well. Remember with the bottom rod, the numbers increase from bottom to top? Well, on the upper rod, the numbers increase from top to bottom. Let's see why this makes a difference. We will compare the fractional lines between 2 and 3 inches on the bottom rod and the top rod. On the bottom bar in the left image, the fractional line that represents the 2 1/4 inch mark is here. The 2 1/2 inch mark is here, and the 2 3/4 of an inch mark is here. Now on the upper bar in the right image, the fractional line that represents 2 1/4 inches mark is here, the 2 1/2 inch mark is here, and the 2 3/4 of an inch mark is here. Remember, the bottom rod numbers increase from bottom to top. The upper rod numbers increase from top to bottom. The simplest way to interpret the calibration markings correctly is to observe the direction that the whole numbers are increasing. Then you will be able to interpret the fractional markings correctly. Now here's some good news. If you're measuring someone who is taller than the height of the bottom rod, you can ignore the numbers on the bottom rod completely and focus on the upper rod and indicator line. For the rest of this lesson, we will focus on using the upper rod and reading from the indicator line. Now that you have learned the basics, let's determine a patient's height in feet and inches. In this image, the patient's height is 5 foot 3 1/2 inches. Here's how this was determined. Once the patient is on the platform with the headpiece flat on their head, follow these steps. Step 1. Find the number of feet nearest to the indicator line. In this case, it is 5 feet. Step 2. Find the nearest whole number in inches. In this case, it is 3 inches. Step 3. Find the fractional inch closest to or on the indicator line. In this case, it is in 1/2 inch. And step 4, document the final result. In this case, you will document the height as 5 foot 3 1/2 inches. It's your turn. What is the height indicated on the height rod? I'll leave the steps there for you for the first one. Pause the video, then play it when you're ready for the answer. If you stated 5 foot 4 1/4 inches, you are correct. Now try it without the steps in view. What is the height indicated on the height rod? If you stated 6 foot 4 3/4 of an inch, you are correct. Great job. Next, we will examine a height rod that only has the number of inches. You will notice that there are no feet calibration markings on this height rod. For this type of rod, you must know how to correctly convert the number of inches to feet and inches. To do this, you must know your multiples of 12. I strongly suggest that you know at least up to 12 times 7 without having to even think about it. As you see, a person who is 36 inches is 3 feet tall. 48 inches is 4 feet tall. 60 inches is 5 feet tall, and so on. Quickly, what's 12 times 7? If you stated the answer before it appeared, great job. If not, don't worry, you just have some studying to do. Remember, commit to knowing the multiples of 12 up to 12 times 7 to memory. I say up to 7 because very few people are above 7 feet tall. Let's practice applying the multiples of 12 to measure a patient's height correctly. In this image, the height indicated is 4 feet 7 and 3/4 of an inch. How was this determined? Here's how. Step 1. Find the whole number inches nearest to the indicator line. In this case, it is 55 inches. Step 2. Convert the whole number of inches to feet. If the patient is 55 inches tall, that means they are at least 4 feet tall. We will document the number of feet as 4 feet. Step 3. Determine the remaining whole number of inches. Since the patient is 55 inches and 48 inches equals 4 feet, there is a remainder of 7 inches. Document this in your answer. So far, we know that the patient's height is at least 4 feet 7 inches. Now let's add the fractional inches to complete the patient's height. Step 4. Find the fractional inch closest to the indicator line. In this case, it is 3/4 of an inch. Step 5. Finally, add the fractional lines to your answer. In this case, the patient's height is 4 foot 7 and 3/4 of an inch. Now it's your turn. Determine the height indicated on the height rod. I'll leave the steps there for you for the first one. You may pause the video and play when you're ready for the answer. If you stated 4 foot 9 1/4 of an inch, you are correct. Now try it without the steps in view. What is the height indicated on the height rod? If you stated 5 feet and 1/2 an inch, you are correct. As you have noticed, knowing the multiples of 12 is very important. Don't get caught counting on your fingers. Document the patient's height quickly and accurately. And there you have it. You have learned to interpret the calibration markings on the adjustable height rod of a physician mechanical beam scale, and determine the height indicated on the height rods with and without the number of feet indicated on the rod.